I'm going to be talking about implementing a new safe ride system here at the University of South Carolina. Currently, we have a Carolina Cab safe ride system at USC and it's represented by our student government. The Carolina Cab offers free rides to students within a 5-mile radius of campus from 10 p.m. to 2 a.m. Thursday through Saturday. The Carolina Cab system has excellent intentions to reduce the number of students driving under the influence of alcohol, but the program could be more effective if it were expanded to accommodate to students' needs. Okay, so here's some background information on alcohol-related vehicular fatality in the United States. In 2011, the CDC reported that every 48 minutes, one person dies in a motor vehicle accident involving an alcohol-impaired driver. This means about 30 people die and 30 different groups of friends and families suffer the consequences of someone else's decision to drink and drive every single day. About 34% of these alcohol-related fatalities involve an alcohol-impaired driver that is between the ages of 21 and 24. This statistic really kind of tells us which age group intervention should really be directed towards. To break this down even farther and kind of hit the issue at a more personal level, I contacted the Substance Abuse Prevention and Education Office in the Student Center, and they were nice enough to share some survey results with me that they gathered from surveys students have taken when participating in the alcohol education course online. And these results were gathered in 2011. 22.7% of females and 28.8% of males admitted to driving under the influence of alcohol in the past year. 20 to 30% of students may not sound like a lot of people because it isn't the majority of students driving under the influence, but what you have to think about is the fact that there are about 33,000 students enrolled at USC's main campus. 20% of 33,000 is about 7,000 students. And this number is just USC students alone. This isn't even counting the amount of drunk drivers there are out there that do not attend USC. Another thing that I found interesting was that 15.9 of campus residents, who keep in mind are eligible to ride the Carolina Cab, had driven under the influence of alcohol in the past year, and 32.9% of off-campus residents have done so. So you can see that for whatever reasons, for which I'm about to discuss, students who are able to use the Carolina Cab Safe Ride system are not using it. And because off-campus residents are even less likely to have a safe ride option, they are more likely to drive under the influence of alcohol. Okay, so these are the reasons why I think the Carolina Cab Safe Ride program is lacking in its effectiveness. First of all, only 3 students can be transported at a time. Economically, I don't think this makes sense. The opportunity cost, which would be time and gas money, is exceeding the benefits received by the Carolina Cab. 3 people is just really not a lot of people, and why only transport 3 at a time when we have hundreds of students who go downtown Thursday through Saturday? This means most of them don't even have the time it takes to wait on the Carolina Cab, and you can only ride it if you are traveling in a group of 3 or less. So this creates a long wait time, and not to mention if you live farther than 5 miles away from campus, you have to find another way home, which will most likely involve someone driving or riding with someone under the influence of alcohol. Also, it's more dangerous to travel in smaller groups. Criminals approach people who seem to be in a vulnerable position, and I would say that a situation in which 3 girls are waiting on a cab alone creates a very vulnerable situation. So we have shuttles in neighborhoods such as Woodlands and Copper Beach that take residents downtown and pick them back up. These residents are allowed to bring 1 guest per person, which I think is a very great idea, but these shuttles are very overcrowded, and I think this has a lot to do with the number of guests that are riding the shuttle due to lack of a better solution. Also, there's a good chance that these guests will still end up driving under the influence after arriving to a neighborhood that they don't live in. Lastly, the Carolina Cab's last pickup is at 2 a.m. I thought that changing how late the cab runs is worth discussing, though I don't believe that it is as important as the other 2 issues. But most bars do not close at 2 a.m. on Thursdays and Fridays. They only close at 2 a.m. on Saturdays by law. A lot of students would prefer to stay out until the bars close, and if they have to leave a little bit before 2 a.m., which they may consider very early, they may decide that they would rather drive home and stay later instead. Here are my ideas about what we can do to improve the Carolina Cab Safe Ride system. First off, I think that we should take two shuttles that are already owned by USC and map out designated pickup and drop off points for students that live within a 10-mile radius of campus rather than a 5-mile radius of campus. Let me reiterate that off campus students are the students who need safe transportation to and from downtown the most. They live farther away, so that's more time that they would be on the road and further distance for them to drive while under the influence if they had no other option. This transportation would be free for students, and just like with the neighborhood shuttles, students would be allowed to have one guest ride per person if a friend came from out of town to visit. Secondly, I do recognize that even a 10-mile radius from campus may lessen the safe ride limitations, but it doesn't completely solve the problem altogether. We can't get all intoxicated students off of the roads, but this next revision may provide a more compromisable solution. In addition to two shuttles, I think we should have two Carolina cabs running that can transport students who live farther than 10 miles away from campus. These students would be able to ride for free for the first 10 miles, then pay for every mile after that. That way, students who live farther away won't have to pay as much as a regular cab. Lastly, I think that shuttles should have their last pickup at 3:30 a.m. on Thursdays and Fridays and have a last pickup at 2:30 a.m. on Saturdays. This way, students won't have to leave bars before last call on Thursday and Friday nights, and this might provide a little bit of incentive for them to utilize the Safe Ride system rather than drive themselves. I also thought about one way to help raise funds to implement this program. I know this won't cover all of the costs, but I do believe it will make implementation of a new Safe Ride program possible. Every student is required to take a drug and alcohol education course online upon entering USC as a freshman or as a transfer student. The course is broken down into two different parts that are taken at two different times. And I propose that every student pay a $25 fee for each part of the course, and the money would be collected towards the implementation of Carolina Safe Ride. In conclusion, I've provided evidence that shows that there is a need for a safe ride system of larger scale here at the University of South Carolina. The changes I propose will greatly reduce the number of USC students that will drive under the influence of alcohol. This is a great opportunity to modify students' drinking and driving behaviors and make Columbia a safer place to live. Advocates of public health must first recognize that knowledge of negative consequences is not enough to modify a behavior. It is inevitable that college students participate in risky behaviors such as the overconsumption of alcohol. However, with strategic initiative, we can effectively administer options that will greatly reduce risk of alcohol-related fatalities in our community. These are my sources, and thanks for watching.